What is mental health? There's many definitions, but ideally what we might want to think about is picking out some of the key elements. And some of the key elements might be about the ability to develop psychologically, emotionally, and spiritually and intellectually. Some other elements might include the ability to start relationships and keep those relationships going, and also the ability to understand what other people are communicating. We call that empathy, and also the ability to use psychological distress in order to learn from that as a developmental process rather than something that you can't cope with. So what types of mental health difficulties are most common in children and adolescents? So if we take children first, so that's our kind of primary school age, the main difficulties kind of fall into two clusters. So one is a cluster which includes developmental difficulties. So that's something that you might be born with, which might include attention difficulties, hyperactivity difficulties, or things like autism. And those will impair your ability to socialise and make relationships, and also might impair your psychological and intellectual development. The other cluster of difficulties found in little children in primary school age is difficulties around managing your conduct and behaviour. So that's struggling with emotions, struggling with relationships, struggling with taking instructions from adults, and struggling with sort of your peer relationships. And those are often classified under a group of difficulties called conduct problems. In adolescents and teenagers, so that's mainly secondary school age and college age, the difficulties from childhood, like conduct difficulties and all of those developmental problems, can carry over and cause difficulties obviously into teenage and adult life. But in addition to that, what we also notice is that the teenage years are a time of great change and development for young people, and the emotional challenges and the intellectual challenges and relationship challenges that come with growing and developing often become classified in different mental health difficulties. So they often fall around two main clusters of low mood, which we might call depression, or difficulties with fear and anxiety. We have lots of sub-clusters of those different difficulties, but often they can come under those two main headings of depression and anxiety. The other thing that we see lots of teenagers for is when they're having difficulty coping with their mood or fears, and sometimes those young people will have thoughts of harming themselves, or will have actively harmed themselves by cutting or trying to hurt themselves in a more serious way, and that's where our CAMS service is a specialist service, in that we will help people manage those risks and manage their safety. We also do some work with young people who are seen as at risk from other people, or who are seen as being risky to other people, but that's very specialist, and that's something that people can find out by coming to our service and asking